Good morning, everyone. I'll be presenting a poster podium on endocapsular ring implantation in subluxated cataract or modified technique. I directly jump to the what are the modification we did in for insertion of capsular endocapsular ring implantation. For insertion of capsular reservation modified technique, the CTR Unio ring is introduced through the main incision with the help of forceps, so that the leading eyelid and the part of CTR inside the capsular bag. A second instrument, Sinski, was introduced through the anterior chamber through side port incision, which was kept over the part of CTR just outside the bag, gently pressing it. The second instrument guides the remaining trailing part of CTR Unio ring smoothly into the capsular bag as you push the ring with the forceps from outside the eye. What are the advantages? Firstly, it prevents the inadvertent escape of the endocapsular ring out of the bag in the sulcus. Secondly, it avoids any stress on the anterior capsule margin, thereby preventing tear or extension of the rhexis margin. Thirdly, it changes the vector force from vertically anterior-posterior to horizontally along the capsular bag, thereby reducing stress on existing intact zonules, preventing posterior dislocation of capsular bag CTR complex into the vitreous cavity. What is another modification we did for scleral fixation of Sioni ring? For scleral fixation, we first bent the straight needle of double arm time-0 polypropylene and made it a curved modification. That what we have achieved, it keeps the plane of the needle tip higher during its passage into the anterior chamber, preventing the damage to intraocular structure posteriorly, especially the capsular bag. Secondly, another modification made by us was to prevent capsular bag damage was use of a band 26 gauge needle to fetch the band curved needle of the 10-0 polypropylene suture outside the eye. Advantage of using band 26 gauge needle rather than a straight needle is that it keeps the direction of the tip upward during the passage through the scleral bed into the anterior chamber, so that the chances of the piercing and damaging capsular bag is very unlikely. Secondly, the feeding of the band curved 10-0 needle into the band curved 26 gauge needle become easier compared to straight needle as shown in the figure. To conclude, with the help of various endocapsular ring segment insertion and our modification, we could smoothly and safely implant the endocapsular ring in subluxated cataract with higher success rate, minimal intraoperative complication, and good postoperative outcome.
You think that the bent needle, its tip is intact, isn't it?
Yes, sir. We used to bend that 26 gauge needle as well as that 10-0 propylene, so that it is very easy. It is much better.
I'm just interested in knowing how often have you damaged the capsular bag with that bent needle? That's all.
With the straight needle, sir.
The one in which you
sir, we did, sir, 29 cases, and 3 cases. In three cases, there was enlargement of that rhexis margin or piercing with structures.
What could you have done to prevent it?
So, for preventing the rhexis margin, sir, then
anyway,
we
just inflate the bag with a good visco or Elon. Thank you.